All right. Well, good morning, everybody, and welcome. Thank you very much for joining us this morning. My name is Jen McEwen. I'm the state senator representing most of the city of Duluth on beautiful Lake Superior. And it is my great honor and privilege to be here this morning with my colleagues, Representative Liz Reyer, Representative Liz Boldon, Senator Omar Fateh, and Senator John Marty, to announce the formation of the Minnesota Health Plan Caucus in the Minnesota Legislature. If you'll notice, we have 4 new legislators in our first term, and also one of our mentors, Senator John Marty. I know that for me, and I can't speak for all of my colleagues, but I think that there is a common thread amongst us, that when we were running for office, when we decided to run for office, and we were running our campaigns, we heard a lot from our constituents about wanting to see a comprehensive, universal coverage healthcare plan for Minnesota. I know that I heard that in Duluth from many people across the spectrum of the healthcare industry, business, leadership, local leadership in our municipalities, and patients who had heartbreaking experiences with the health insurance industry and knew that we needed some change. So they're asking for some transformative change within our healthcare system here in Minnesota. So that issue, amongst others, but that issue in particular, was something that really drove me in my run for the Minnesota State Senate, and that my constituents are very hopeful that is coming up in our future for Minnesota. So the work that we're doing, and the reason why we decided to form this caucus, is because there has been a tremendous amount of grassroots organizing done by citizen groups, by advocacy groups in the state of Minnesota to build up education and awareness about the Minnesota Health Plan, authored by Senator John Marty. And again, this is a broad coalition of health justice allies, Healthcare for All Minnesota, groups of healthcare providers, labor, business, municipalities, farmers. It is a broad coalition, and after our press conference today, we're going to go out to the Capitol steps, and people will be able to hear from this coalition of allies who are all coming together and have done so much work around organizing for the Minnesota Health Plan. So the purpose of what we're trying to do here in the legislature is to create a structure within the Capitol to give voice and to elevate the work that has already been active and happening with those allies at the grassroots level. We've seen for a number of years since Senator Marty introduced his plan, and I will note that Senator Marty wrote a book about his bill and making the case for why we need a comprehensive health care plan in Minnesota that will have, again, comprehensive coverage in terms of care. It will cover things like eye care, hearing, dental, mental health care. It's comprehensive in that way. And it also covers everybody. So people's health care is not tied to their employment. They just get health care as a right by virtue of being a Minnesotan. And so if you haven't checked out this book by Senator John Marty, please do. He has a website that has a wealth of information answering people's questions about this plan, cost, coverage, all sorts of the normal questions that people would have about what this would look like for Minnesota. And that's at mnhealthplan.org. People can check out that website. Just real quick before I pass the microphone off to my colleagues, I wanted to note just how important it is for those of us who live outside of the metro in Minnesota to be pursuing this plan in particular. In northeastern Minnesota and in other parts of rural Minnesota, we've seen a consolidation within the healthcare industry. And this is the natural result of having a profit-driven healthcare system, where now we have a situation, for example, for people who live in Grand Marais, Minnesota, up on the shore, North Shore, up close to Canada. People who live up there who are having a child have to make a 2.5-hour drive on a 2-lane highway 61 along Lake Superior to get down to Duluth to deliver a baby. That's unacceptable. It shouldn't be like that. There's no reason why we should have those shortages. So this type of health plan would allow us to have more control and to make sure and to ensure that we have adequate services throughout the state of Minnesota so people don't have to, for example, drive 2.5 hours when they need to deliver a baby. And that reason, as well as the financial reasons for passing something like this, are what led my city of Duluth, just very recently at the end of last year, to pass a unanimous resolution in the city council asking our legislative delegation to move forward with the Minnesota Health Plan. And in that resolution, and again, it was passed unanimously by the Duluth City Council, which I think speaks to the growing recognition across party, across political ideology, across that spectrum of just the myriad of reasons why we need to adopt a universal health plan like the Minnesota Health Plan. So the Duluth City Council spoke to how the Minnesota Department of Health just last year noted that at the current rate of growth of Minnesota's total healthcare spending is forecast to double in the next 10 years, to be 19% of our state economic spending, more than housing, more than transportation. And additionally, the Duluth City Council noted the growing cost of the healthcare for our municipality, and that we are at a breaking point. So that really is the takeaway, that we are at a breaking point in our healthcare system. This is being recognized across interest groups, across municipalities, and there's a growing recognition of the need for a plan like the Minnesota Healthcare Plan. So with that, I will pass the mic over to my colleague, Representative Liz Reyer, and she'll share with us some of the issues that she'd like to raise as well. Thank you.
Thank you, Senator McEwen. Good morning. I'm State Representative Liz Reyer. I represent Eagan House District 51B, and thank you all for being here. I also want to acknowledge and thank our House sponsor, Representative Cedric Frazier, for carrying this bill, another first-term representative who also tapped into the vision on the importance of this and is a leader in making it happen. But I'm here as part of the Minnesota Health Plan Caucus because healthcare is a basic human right. And we have a responsibility to ensure that everyone in our state can get the care they need. Unfortunately, the employer-based healthcare system in place now was not designed with this goal in mind. Its initial purpose was to give employers a way to attract workers during World War II wage freezes. And while this was appealing to workers, the health of employees was not the primary motivation, and that shows today. In our system, the core relationship between provider and patient can get lost. Employees face open enrollment decisions that trade off benefit sets, provider networks, and costs. Employers and payers, like insurance companies and pharmacy benefit managers, make decisions about what drugs to cover and whether patients really need certain procedures and tests. Complex processes on the payer side add costs. Doctors get frustrated by insurance company oversight, and the person receiving care gets further and further from the decision-making. Adding to this, we've seen actual costs of care, including prescription drugs, skyrocket beyond logical levels. Finally, access to benefits for working people are not equal based on where or whether they work, with sharp differences between large and small companies based on the resources they have to invest. The Minnesota Health Plan redesigns this system. It takes out structural barriers between patient and provider. It equalizes the opportunity for small and large businesses, and it removes much of the costly complexity in our current system. It creates openings for entrepreneurship because people are no longer bound to jobs to keep their benefits. Entrepreneurs are job creators, and we need them in order to have a thriving economy. For small businesses, it removes administrative burdens that take business owners away from their core business. In short, the Minnesota Health Plan offers a better experience for patients, providers, and employers, and uses valuable healthcare funds to pay for care, not administration. It ensures that care providers spend their time with patients and not paperwork. It makes healthcare work for everyone. I've said that healthcare is a basic human right. It's the moral thing to do. In addition, though, as legislators, we are responsible to be good stewards of state resources. The Minnesota Health Plan uses our dollars wisely, and it makes good economic sense to invest in the people of our state, to have healthy people and a healthy community. It's time to move the Minnesota Health Plan forward. Thank you. And now I will turn it over to my colleague, Senator Omar Fateh.
Thank you. Hello, everyone. My name is Senator Omar Fateh. I'm the state senator representing South Minneapolis, District 62. So thank you all for being here. I could not be more proud of my colleagues who are joining us in forming this caucus and our outside organizational partners in the Healthcare Justice Coalition, who have been fighting this difficult fight for years. I also want to thank Senator John Marty, who has been the author of this legislation and has spent so much of his career fighting to fix our broken healthcare system. Healthcare justice is a major racial and economic justice issue for our state. We see huge racial disparities between our BIPOC Minnesotans and their white peers when it comes to healthcare outcomes. The infant mortality rate, for example, is disproportionately much higher for Black babies, and that's simply immoral. Part of why we see these racial disparities is that under this employer-based get-what-you-can-afford system, BIPOC communities simply are not receiving as high quality of care as their white neighbors. And due to high out-of-pocket costs, they are likely to seek out and receive care. They are not as likely to seek out care in the early stages of illness, which saves lives and can prevent the major need for major treatments down the road. We begin to close the gaps when it comes to the health care of our people, but to do this, in order to do so, we must separate the quality of care from the ability to pay. There have been past attempts to do this without moving to a single-payer system. They have not worked. There's only one way to address our needs, and that is to guarantee health care as a human right for everybody. I want to close by addressing a topic that is on the minds of everybody here in St. Paul, and that's the issue of public safety. That for far too long, policymakers have ignored the connection between public safety and public health. We have tried to put the two in discrete boxes, and we have only attempted to improve public safety through punishment, penalization, and incarceration. And that is a failed approach. I think nearly all of my colleagues on both sides of the aisle would agree with me when I say this. Mental illness, addiction, these are major aggravating factors when it comes to the challenges in public safety. Yet, as a state, we do not guarantee high quality of care for those who are struggling the most. The Minnesota Health Plan is the solution to this problem. It is the only way to ensure that every single Minnesotan is able to receive high quality care that they deserve. And when it's finally passed and signed into law, Minnesotans can begin to see its far-reaching impacts in racial equity, economic equity, public health, and public safety. So I'm grateful to everyone who is here with us today. So let's come together and let's get this done. Thank you. And I'd like to pass it to my colleague, Liz Boldon. Representative Liz Boldon.
Good morning. I'm State Representative Liz Boldon. I represent District 25B in Rochester. I'm also a registered nurse. I'm excited to move the Minnesota Health Plan forward for the same reason I've worked in healthcare for nearly 20 years, because I believe healthcare is a basic human right and everyone deserves care, no exceptions. Nearly 2 years in a global pandemic has highlighted the necessity of this. Not only is it the humanly just approach for everyone to have access to quality health care, but it's a matter of public health and safety. The Minnesota Health Plan would be a single statewide plan that would cover all Minnesotans for all their medical needs: prescription drugs, vision and hearing care, mental health care, dental care, chemical dependency and substance use treatment, medical equipment and supplies, home care services, and nursing home care. It would allow patients to choose their doctors and care providers. It will reduce costs by negotiating fair prices and cutting administrative bureaucracy, not by restricting or denying care. It will focus on preventative care and early interventions to improve health, a true health care system, instead of the sickness management patchwork we have now. I cannot tell you how many patients I have cared for in the ICU who were there because our healthcare system failed them. The grandmother who could not afford her blood pressure medication, so she rationed it and ended up in my ICU after having a stroke. The young father who could not afford dental care and ended up in my ICU with a brain infection from an untreated tooth decay. The middle-aged mother who worked 2 jobs and had insurance, but couldn't afford the copays for the tests her provider recommended, so ended up in my ICU by the time her cancer was discovered, when it was far less treatable. A man who needed a fairly complicated surgery, had insurance, and spent hours, days, and weeks trying to navigate the complex and opaque system to ensure the surgeon he chose was in network and covered by that very expensive insurance, only to find out afterwards that due to some fine print, it wasn't covered, and he ended up owing tens of thousands of dollars out of pocket. Sadly, these stories are not unique. Nearly 5% of Minnesotans have no health coverage at all, and upwards of 1 million Minnesotans who have coverage still cannot afford the care they need. Healthcare expenses are the cause of more bankruptcies than all other causes combined. This is wrong. The good news is it doesn't have to be this way. We can ensure that all Minnesotans have the care they need, and the Minnesota Health Plan is the way to do that. I'm grateful for the partnership of ally and advocacy organizations and for so many of my colleagues who are also committed to this work. We'll continue until we get that done and all Minnesotans have the care they need and deserve. Thank you. And with that, we will take questions if you have any.
I assume the legislation has been introduced in both bodies. Do you expect that the House will act on it this session?
So it has been introduced in both bodies, that's correct. Senator, yes, it has in both bodies. I do, there's the challenges of the divided legislature, and we know that this is not going to, cross the finish line, immediately. There is still work to be done, and that's why we are here. We are going to continue that work. We are hoping for movement in the House. It would be excellent if we could have even an informational hearing this session. I will be advocating for that. So we will keep pushing and keep working. This isn't something that's going to happen immediately, but there's, as has been said, there's the grassroots. There's a desire for this and a need for this across the state, and so we are working to do that work under the dome as other organizations are doing that across the state.
I just would really quickly add, one thing that's really important for people to know is that Senator John Marty introduced this legislation some time ago, and it has been introduced in both houses now for some years, right? We have a number of colleagues, and actually I think we're at about 60 members who, when we formed this caucus and we put out the word and said, would you like to join us? They said, yes, please add our names. So we have 60 colleagues who have joined us in the formation of this caucus, some of them have been co-authors in past years and are co-authors right now. But there is a desire to see this. So the formation of our caucus is really to just take this up to the next level of organizing within the state legislature, and again, to bring the advocacy of all of those allied groups out in our community, the Minnesotans who are clamoring for us to act on this.
Senator Marty, would you answer a question? So I've talked to you about this a couple of years ago, and as Senator McEwen just said, this has been something that you have been carrying for a long time. So what does it mean to you personally now that you have this groundswell around you that I don't think you've had quite like this before?
I got to say, I'm very excited These four and their colleagues came together to form a caucus for the sole purpose of trying to figure out the strategy to make this happen. We have to make it happen. We can. And, you know, some folks in our own party will say that, you know, hey, this isn't going to happen. I keep thinking, well, we can't go that fast, they keep saying. We got to tinker a little bit more here. We can do a little better here. Francis Perkins started pushing for this during the New Deal almost 90 years ago. And the stories that Liz tells as a nurse, every one of us has heard people. We know people who die from this. We know so many people who are struggling with mental health and they can't get the treatment they get. And we have to do it. And so what I got to say is that when they've got 60 colleagues co-authoring a bill, when they're pulling together to organize it, yeah, maybe this year we can get moving forward on getting a cost estimate for